I'm going to get started. I'm Kate Wilson. I work for Multnomah County, and I'm here today with a team from Multnomah County Public Health, from Integrated Clinical Services, and our community partners to talk about COVID-19 and chronic disease. Today we have Rachel Banks, the Public Health Director at Multnomah County, Tasha Wheat-Delancey, the Interim Director of Integrated Clinical Services for Multnomah County, Dr. Laura Byerly, the Medical Director for Virginia Garcia Memorial Health Center, and Lori Ann Lima, a family nurse practitioner with Wallace Medical Concern. And after folks speak, we'll take some questions. With that, I am going to turn it over to Rachel Banks.
Thank you, Kate, and hello, everybody. Welcome to the first day of Public Health Week 2020. I'm beginning to talk about public health in three ways: the public health system before a pandemic, such as we're in, the public health system during a response, and what the public health system should be doing after. And while we're rightly and squarely focused right now responding to COVID-19, there's also a link to our long-term work, the work that we do every day in public health. There's a link between that and our current response that I want to make sure doesn't get lost. And that link is chronic disease, both prevention and maintenance. In Oregon, there are 44% is estimated of people that have a chronic disease or an underlying health condition. And that's the phrase that we use when we're talking about what puts somebody at an increased risk for severe illness from COVID-19. So today I'm going to talk with you about what those underlying health conditions are and who they impact. People with chronic disease have a higher risk of some more severe illness from COVID-19. And the percentage of COVID-19 patients locally with at least one underlying health condition was higher among those requiring hospitalization and intensive care. The most commonly reported underlying health conditions related to chronic disease are lung disease, diabetes, and cardiovascular disease. And among those in Multnomah County who tested positive and whom we have interviewed thus far, we know that 19% have an underlying lung disease. That's nearly 4 times higher than the general population. We see 15% have underlying diabetes, which is more than twice the rate of the general population, and 13% have cardiovascular disease, which is more than twice the rate of the overall population. So we can't talk about chronic disease in Multnomah County without talking about health injustices. And in the same way that COVID-19 disproportionately hits people harder who have underlying health conditions like chronic diseases, and because the way that injustices have been baked into our society, COVID-19, or chronic disease, disproportionately strikes Black, Indigenous, and people of color, and those who live on a low income. We see inequities across a variety of groups, and we also know that some of the most egregious disparities and inequities for chronic diseases here locally are found between our African American, African and Black populations and their white counterparts. So in Multnomah County, consider that compared to their white counterparts, there are more deaths observed from chronic diseases for African Americans than should be tolerated. 24% more deaths from heart disease. African Americans experience 68% more deaths from stroke, and the diabetes mortality rate is 2.5 times higher for African Americans. I want to be clear that we're not saying that Black, Indigenous, or people of color are more likely to get COVID than anybody else. It's about exposure, but they are more likely to have those underlying health conditions based on a variety of factors. So not only is there a risk for chronic disease in Black, Indigenous, and people of color, there's also risk for disproportionate exposure to COVID-19. Because people of color or with a low income are essential across the nation, or more essential, they have higher rates of being in services such as food care services or healthcare industries, especially taking care of our most valued and vulnerable seniors in long-term care facilities. So not only are those workers essential, but usually those jobs pay lower wages and may leave folks without the sick leave or the insurance benefits to take care of their own health. So while we in public health have said and will continue to say, please stay home when you're sick, with a variety of symptoms, including mild coughing, illness, we also want to make sure that our residents and partners are hearing us say that folks with chronic disease, we're here for you, and we want you to come in and be able to take care of your chronic disease. And so with that, I will turn it over to Ms. Tasha Wheat-Delancey. Thank you.
Hi, I'm Tasha Wheat-Delancey. I'm the Interim Integrated Clinical Services Director and Interim Executive Director for the Multnomah County Health Centers. I'm going to talk about this in two ways, similar to Rachel, kind of our everyday work and what's changed because of COVID-19. The work of all community health centers, including here at Multnomah County, is to address access to affordable health care. That means not only being a safe place to speak with a provider, a nurse, a pharmacist, a dentist, but a place to get support with food, signing up for benefits, and transportation. In the middle of this pandemic, COVID-19, community health centers across the country continue to lead this work. Yesterday, today, and tomorrow, Multnomah County Health Centers will be here for patients and the community to meet your healthcare needs. We're the largest safety net provider in the state of Oregon, and we can serve anyone here in Multnomah County. We have 23 clinics across 18 locations, including primary care clinics, pharmacy, student health centers, dental clinics, and HIV support as well. Some of our patients are especially vulnerable and need to stay at home. For those individuals, we're working with them to make sure they get their medications, healthy food, and care advice. However, because of COVID-19, we've had to make some changes in the ways that we provide care. We've shifted to telemedicine wherever possible. And really that's about, you still get to connect with a provider or someone on the clinical health team, but that service may be over the phone. And yes, we're still seeing patients in our clinics, but we do ask our patients to call us first to talk about their care needs, and then we can schedule time to follow up with them. Currently, we're also only providing urgent dental care services at our East County clinic, but we're still available to you. Our pharmacies are open and available to assist patients with refills. Our behavioral health services remain available as well, and they're providing some telephone services. And our Park Road Student Health Center remains open to provide care also. Again, our message is about, we want you to know our services remain available to you. If you're looking for a new medical home, we're also accepting new patients. Yes, now in this moment as well. And anyone, whether you're sick or well, or if you just have questions, you can reach out to us for care. Just call 503-988-5558. And I just want to end with saying I'm so proud of our community health staff who continue to make sure this care is possible, that the doors are open and the phones are ringing. Their dedication to both our patients and community assures that we're keeping the communities healthy and our patients healthy. And we're still here for you. Now it's my pleasure to turn this over to my colleague at Virginia Garcia.
Hi, I'm Laura Byerly. I'm the medical director at the Virginia Garcia Memorial Health Center. I'm a family physician. And we serve people in Washington and Yamhill counties, currently have about 50,000 established patients. We have dental services, pharmacy services, mental health, behavioral health, as well as primary care. And we too have switched from mostly in person to mostly telemedicine visits. We are still establishing new patients. We are trying to figure out how to do the chronic disease care for those folks who have higher risk conditions. How do we take care of them and try to get to the same quality that we knew how to do in person and switch that over to doing it by phone. How do we get people their medicines that they need? We're learning how to mail people medicines and use our community health workers to reach our even more vulnerable patients than sort of our average vulnerable patient. We are still using our school-based health centers. We're trying to funnel people who have need their vaccines, like little babies who need vaccines, to a place that has lower volume and less risk for staff and patients. It's been a really amazing transition. I'm sure we all are experiencing the same thing of moving to this whole other way of doing care in order to try to keep serving this population. Let's see, I think I've kind of hit all the main points. We are taking new patients still. We are trying to do every single contact with a provider by phone first, and at that moment in time evaluate, okay, what do you need that we have to do in person, and then really make that a slick process in and out of the clinic so that everyone is as safe as possible, and minimizing a chance of passing this virus along. I think that is the main thing I need to say today. I will take, certainly if there are questions specific to Virginia Garcia, I'll happily answer them. And I'd like to turn this over to Wallace Medical. Take it away.
Thanks so much, Laura. My name is Lorianne Lima, and I am a family nurse practitioner at Wallace Medical Concern. We are a smaller version of Virginia Garcia in that we have a clinic located on the East Portland-Gresham line. We are a nonprofit and a federally qualified health center, so we see patients who are uninsured, who have insurance, who have insurance through the Oregon Health Plan. We also take some private insurances. We don't have any geographic limitations, so we can see patients from a variety of different places and settings and insurances. We serve about 6,000 patients in our clinic, and we are taking new patients, so we would love to welcome new patients. Similarly, I think as everyone in the area, we have shifted to telemedicine. It's been an interesting challenge, and also we're happy with how we're able to serve people while protecting the community. We do see people with various chronic diseases, and as Laura said, we're figuring out how to manage those things, and we're determining first by phone if we actually need to see you in the clinic. We understand that there are some people that have urgent needs that need to be seen, and we want you to get the care you need so that you don't necessarily need to end up in the hospital. So I think that's an important piece, is that we're all figuring out what is urgent and what does need an in-person visit. We want you to know that we are taking precautions for people who do come into the clinic. We are checking temperatures of all the patients and staff as they come into the clinic to be sure that no one has an acute illness that may put other people at risk, and figuring out how to triage or decide how that person can best be helped. We're masking patients and staff as they're together, so we want people to feel comfortable and safe when they're with us. I do want to say that we have quite a bit of services too. We also have a full service dental clinic that's seeing people through telemedicine, also video medicine. We have mental health services, both similarly through telemedicine and video visits. We have a psychiatric nurse practitioner and behavioral health providers that are helping support people during this challenging time. We have many providers who speak Spanish and many staff that speak Spanish. We have access to interpreter services. So we're really there for the community in any way that you may need it. I think that covers most of how our care has changed and the folks that we serve. Like I said, we're happy to see new patients. We are inviting new patients and also starting that by telephone. You can call us at 503-489-1760 to schedule an appointment. And as the other clinics, we ask you to call first before arriving at the clinic. And I think at this point, we'll be opening it up for questions. Happy to answer any of them.
Yeah, so if folks want to raise their hands, I can unmute you over. Camila. All right, Camila?
Yes. Hi, this is Camilla with Fox 12. I realize this is maybe more of a state issue or question, but I wanted to see if anyone had any thoughts on the fact that we're sending, that Kate Brown announced we're sending ventilators over to New York City because they're needed there. Does anyone have any thoughts on that, on, sending away resources or, I don't know, anything to weigh in?
This is really opinion, right? I think we are doing a good enough job. Our hospitals are not yet overwhelmed. We can send resources. We would expect someone to help us later if need be. Hopefully it won't be necessary.
I am muted. Okay. Jay, RJ, hey?
Yeah, it's Bob. Hi.
Bob.
Hi, guys. I don't know who's best to answer this question, but we're heading into what will likely be 70-degree weather. The inclination for people to go out and mingle is probably going to be greater. I'm interested in what your take is on how strictly social distancing could be enforced, especially from the healthcare providers and the healthcare workers' perspective. How strongly should police enforce social distancing?
So this is Rachel Banks. Thanks for that question. And you're right. As the weather gets better, I think people are going to be inclined to be out more. We're still really sending the message and asking folks to stay in. Enforcement on this is tricky in that we really want our law enforcement professionals to be able to focus on the work that they need to do and not be using that resource to enforce social distancing. And of course, we also want to be mindful of the impacts of enforcement on various communities, including communities of color. So our primary method at this point is education. We've heard various law enforcement professionals also say that their primary mechanism is to educate people that they've come across. And so we're really counting on people to do the right thing. We know it's hard, but to stay in.
Pat, did you have a question? Pat Doris? Unmute. Let me unmute you.
Muted me.
I did. I'm sorry. You're unmuted.
Thank you. Plenty of people have said I need to be muted. It's a quick question about testing. I'm wondering what you folks think about the state of testing. Is there enough testing going on? Do you want to see more? That sort of thing.
Oh, goodness. What a bugaboo of a question that is. So, of course, we've really been hamstrung. My public health partners can speak to this more specifically than I can. But we're now in this weird place where we've had spread and we don't have enough testing to do all of the contact tracing that would need to be done to do public health in the ideal manner. So we're behind the 8 ball in testing, and we're going to have to do the best we can with that. And I think the situation is going to evolve such that we'll be looking at who's had the disease with antibody testing, and we'll have to have a different strategy for that as we develop new technologies to figure out what's going on with this particular infection in our communities. It's been a suboptimal response, and we're doing the best we can. But yes, more testing of whatever type would have been and will be good.
Am I missing anybody? Anybody else have a question? If not, thank you so much for joining us today. And again, I will, on Multnomah County's end, we'll work on the technology to allow TV to record on your end. Thanks again, everyone.
Thank you.
Thanks. Have a good day.